You should see the New York Times tracker map, the epi curve. This is for the U.S. So you can see that it's higher than it's been at any point in the pandemic. 704,000 new cases on the 5th and over 700,000 on the 6th as well. For Alabama, we see a similar epi curve, over 12,000 new cases yesterday, a rolling average of over 8,000, which again is higher than at any point in the pandemic. One of the things that you can see on this as well is that not only are cases just exploding, although Omicron is milder or results in a milder infection in general than the Delta variant, because there are so many more cases. Even a small percentage of those cases getting hospitalized ends up doing exactly what you're seeing here. And we're seeing an explosion really in hospitalizations in the state. The final thing that I wanted to show is the Alabama map. You might remember earlier in December, this map was multicolored. It had some yellow, it had some orange, and even had some blue counties. And now it's all solid red. And look at this positivity rate, 42%, which is just really astronomical, hard to believe.
So overall, this just looks at us by district, so you can get a feel in Alabama what's happening with cases by district. This is actually the first time that Jefferson County has really led the charge in terms of number of cases, but by the end of the talk, I think you guys will see that may not be so surprising with Omicron. Trying to do the perspective shift again, and I did not update the positivity numbers. This slide was updated on Tuesday. We're looking at about 1,200 cases per 100,000 per week in Jefferson County, where the state more like 750. But if you look at UAB faculty and staff cases, we're at more like 24 per 100,000. Well, what's going on there? People don't have access to tests. So we are dramatically undercounting cases right now in Alabama. It's very hard to find tests. When people try to get a test scheduled, they often have to wait 5 or 6 days. You saw the communication from UAB saying, please don't show up at our ER because you're looking for a test. It's just really hard to get a test right now. I'm sure all of you have anecdotal stories, but people are always emailing me with their stories saying, my 10-year-old tested positive at school through the school testing program. She came home, we all got sick within 48 hours and none of the rest of us in the family could get a test. So I think we have to really keep in mind that our numbers are artificially low right now, just as a heads up. And to put in perspective, I think the really positive thing that is out there is that this particular variant seems to hit cities first. I'm going to show you what I mean here on this slide. This is New York City. And you can see New York City just kind of went screaming along through most of December, but they've already peaked and they're coming back down the other side, not only in cases, but also in hospitalizations. Their trends are almost exactly what South Africa saw: 4 weeks of really intense cases followed by an immediate drop off. Washington, D.C. was the second big city hit, and D.C. is experiencing the exact same thing. Cases skyrocketed, but they're already coming back down the other side. I think that's what we're seeing in Jefferson County. We are a fairly densely populated county, so it's not surprising we would take off first. That probably means that we will come back down the other side first as well. If you compare us back again here to what's happening, you'll notice here we are in Alabama, we're way under where New York City peaked. I don't think we're going to hit New York City's peak, not because we don't have that many cases, just because we don't have access to testing in the same way that New York City does. So I don't expect us case number wise to wind up all the way up here. Here's Florida, they're a little bit higher than us, and also Georgia. So you can get just a feel for what's happening around us. All of those things feed into the estimate for what we're probably going to see. And these are just hospitalizations because, again, I think forecasting cases will be really tough right now. If we do an upper, or if I did an upper estimate and a lower estimate based on several different types of factors, and assuming that we follow, this was South Africa's trajectory, but now it looks like that's holding with New York City too. We're looking at a peak of about 2,000 cases or 2,000 hospitalizations with the lower estimate and about 4,000 with the upper estimate. And the peak is 2 weeks from now. I mean, it's just right in front of us, going to happen quite quickly. And then, like I said, if we stick with what New York City saw, come right back down the other side. I think cases will likely peak somewhere around 20,000 per day based on, again, South Africa and New York City, but then should rapidly drop off after that. There are a lot of things that are going to influence whether we hit 20,000. It's the restarting of schools. You know, the kids are back in school. They're going to be interacting with one another. There is some testing that's happening at the schools, which is a benefit that'll help to get some of those tests reported, but it will also increase transmission. The reporting of home tests, I don't know how home tests are reported. I think they're probably likely not reported, but lots of folks will take a home test and wind up positive. That'll keep that number a little bit lower than 20,000 if we have more home tests than official tests that get reported to the health department. And then we also have to watch out for mutations. It's obviously there's no way to predict that, but if something were to change and Omicron becomes more virulent, then these estimates for hospitalizations will really be a challenge. To me, this particular surge is not about hospitalizations. It's going to be about the number of people infected at one time. We're going to have a lot of folks sick. We already do this week. Next week will be another big week in terms of people being sick. And because you have to isolate for 5 days, even if you test, or even if you're not feeling too terribly poorly, that means people are out of work. They're having to work from home. Students can't be in the classroom. And it's just going to be a very different management strategy than what we've done in the past. The only other thing I was going to show you on CDC's website that it's still really positive, the vaccine still, we're looking at the rate of hospitalization by vaccinated versus unvaccinated. And you can see that the rate of hospitalization among vaccinated individuals is still trending very low. Although their data are a couple of months behind and it doesn't include Omicron yet, it's still a good sign for vaccine effectiveness from the COVID-net data. And again, I want to make sure to highlight, I do not believe that UAB has more cases than per 100,000 than Jefferson County. I just think we have access to testing. We're very lucky to have access to testing.